We have special seats for you here.
The mic is not on. I don't have pocket.
Invite the acting dean and the HODs of the departments of our faculties to come up and take their seats.
Hakan kuma har za a yi lancin magazin? Haka har za a yi lancin? Na ga bata iya MC ba. Kuma MC ma. Ana neman wanda zai nemo kuɗi kuma. A to ya kamata wannan a neman MC. Za a lancin ka ana cin kuɗi ai ko ba sun kuɗi sa? To ai sai a nemi mai baki ai. Kuma haka yin
We'll invite the acting dean and the HODs to come up and take their seats. The acting dean, the HODs, and the invited guest, Mrs. Nuruddin Abdul Salam, to come up and take their seats. And the representative of PSL too. While they do that, we'll be taking the welcome address from our lecturer in person of Dr. Kurama Egurama. He will be welcoming everyone to the event.
The acting dean, invited guests, respected HODs, my senior colleagues, great pharmaceutical science students, you are highly welcome to this great occasion. We'll be starting the seminar in a short while, series number 5, which will be presented by Dr. Itopa Musa Yakubu, HOD Pharmacology, on the topic titled Roles of Nutraceuticals in Electrogenesis. Please, a round of applause. And also, before I invite the acting dean to declare the program open, I would like to call on the past present to welcome his guest. Abdul Kadir.
The acting dean faculty of Pharmaceutical Sciences, head of department, Pharmacology department, the head of Pharmaceutical Microbiology department, the head of Pharmacognosy department, the representative of the permanent secretary, Ministry of Science and Technology, my dear Pansite, respected guests, good morning to you all. It is with deep gratitude that I welcome you today to the opening ceremony of our Pans Week 2025, which is coupled with the faculty seminar. This goes to show the kind of rapport and synergy that is between the staff and the students of Faculty of Pharmaceutical Sciences. On behalf of all the students, as the past president, I welcome all lecturers that are here. And as the past president, I am welcoming all students that are here. Thank you very much. I wish you enjoy this opening ceremony. Thank you so much.
Thank you very much, Abdul. I would like to invite the acting dean to come and have a word and declare the program open. You're welcome, sir. A round of applause, please.
Let me start. Let me start on the already established protocol. The HODs, all the invited guests here present, you are all welcome to yet another episode of Pounds Week, and also seminar, faculty seminar series number 5. This seminar is usually organized by the faculty in order for lecturers to come and share with us their expertise, their research areas, so that we understand what they are doing. And also we look at area of collaboration within the faculty and also outside the faculty in order to boost our research capabilities and also the visibility of the faculty. With this, I encourage other departments. We have heard that from my department, Farm Micro, from prognosy, from clinical pharmacy, and today we are having from pharmacology. We want to see PharmChem next time, and also which other department again? Okay, pharmacology again. So this is highly commendable, and the effort of the seminar organizing committee is really appreciated. With regard to the Pharmacy Health Week, I must also congratulate the current experts because they have demonstrated a lot of capacity during their tenure. And also the kind of unity and cooperation realized during this time is highly commendable, and we urge you to continue to cooperate and execute a lot of activities within yourself that will help you also explore other part of you. The theme of this week, this year's week, pharmacy week is preparing pharmacy students for healthier tomorrow. I think the title of their company. So it's here with us, and I hope you will come for a good message that will give you that hope and will tell you about the opportunities that are waiting for you there in the industry, not only in academic. For those of you that don't want to come back to academia, the industry is there for you. With this, I want to declare this week open and welcome to Hans Week, and the seminar also open. Thank you for that.
Thank you very much, our capacitated acting dean. Before we proceed, I would like to call on the CEO, Kairat Pharmacy, to have awards. A round of applause, please.
Thank you very much, my distinguished senior colleagues and lecturers. It's an honor and a pleasure to also meet some of my colleagues as students and also my lecturers as a student. I'm Pharmacy Surgeon of Islam, and I'm from Kairat Pharmacy and Veterinary Company Limited. It's an honor to be here and also an honor to stand before you all to say one or two things that will probably inspire you to pursue career in industrial pharmacy. Kairat Pharmacy and Veterinary, we are indigenous manufacturing company located in Kano. We are compliant to current good manufacturing practice as established by the most current regulatory reforms. Well, I wouldn't bore you that much, but I want to make you all understand that pharmacy as a profession has a broader scope than we are currently meant to understand. Um, there are a lot of fields of practice for a pharmacist, and what it requires is that as a pharmacy or pharmacist in the making, at the early stage of your studies, begin to equip yourselves with the technical skills and the soft skills that will enable you to compete in the challenging and transforming world out there. Now, in the industry, most of us, when we talk about industry, what we look at is drug manufacturing. But I can assure you, industrial pharmacy or industrial pharmacy practice has a broader scope. It actually bridges a lot of gaps. It bridges the gap from the laboratory analysis, the laboratory tests you do, the research, and commercial manufacturing. And also, it is the sure guarantee to medicine security. So, and as we all experienced a few years ago during the COVID epidemic, when there was almost total shutdown of the global economy, what did we experience? We, in Nigeria, realized how vulnerable we are in terms of medicine security. And currently, as I speak to you, medicine security is actually a national security. So, in the industry, what we do is that we engage in research and development, we engage in drug formulation, we engage in regulatory compliance, we engage in good manufacturing practice, we engage in logistics and supply chain, we engage in sales and marketing. It's a broad field that is waiting for exploration. And fortunately, for this northern part of the country, industrial pharmacies are in low supply. Most people don't take interest in industry. And like I said, drug security is a national security. In the industry, we ensure that there's a continuous availability of safe, effective, and high-quality medicine for the populace. And without the industrial pharmacy or pharmacists, this will be difficult to bridge. We will end up, if we as pharmacists or students or pharmacists in the making do not develop the interest in the industry, we will end up allowing quacks, those with substandard knowledge or have knowledge, to take over that venture, and in so doing, endangering the lives of millions of Nigerians and in Africa at large. So my call to you is, if you have not had the interest or developed the mindset of thinking towards the industry, this is the right opportunity for you. As you walk out of this hall today, you should have a renewed mindset that I am going to pursue a career in the industry. And I pray and I believe whoever takes that step will never regret it. Thank you very much.
Thank you very much, ma'am. Thank you very much, ma'am. A round of applause, please. A round of applause, please. Greatest Nigerian student, greatest pharmaceutical science student. I want to isolate I want to sterilize. I want to dispense. Can I dispense? Yes, under a licensed pharmacist. It's now time for the main program. Let me invite Dr. Yakubu Musa Itopa for a wonderful presentation. A big round of applause for him, please. Members of the high table, please, you can go down to have a view of the presentation. The presentation will be lasting for 30 minutes. Then we'll take another 30 minutes for questions and answers from both online and offline.
The acting team, HODs represents, distinguished colleagues. Let me specially recognize my teacher and my lecturer, Professor Musa Gombe. Please, a round of applause for him. Also, I will not say anything here today if I don't have his permission to talk. Prof, sir, can I say something, sir? Okay, thank you, sir. All right. Other distinguished guests here present, you are all welcome to this occasion. Greatest fan site. Greatest fan site. It is indeed a honor to be in your midst this morning. I'm also humbled and with all pleasure to have the opportunity to share the little knowledge I have with you today. So I'm here to make a presentation on roles of intrinsipal in epileptogenesis. This is the outline for the presentation. By way of introduction, so what is epileptogenesis? So let's not be like you are speaking jargon. Epileptogenesis is simply the sequence of events or process which lead to development of spontaneous recurrent seizure. Spontaneous recurrent seizure is actually characteristic features of epilepsy. So the process that took place before to that's what we call epileptogenesis. And it is first a gradual process of epilepsy development from the initial brain insults to the onset of false spontaneous seizure. As we all know, epilepsy is a chronic, non-communicable neurological disorder that is characterized by recurrent unprovoked seizure with heterogeneous etiology, heterogeneous pathogenesis, heterogeneous clinical features and outcomes. So, epilepsy is not just a disease, it's a chronic disorder. It has different variants, different forms in terms of the causes, the way it manifests, and so many things. It is usually associated with social stigma, significant economic impact, impair quality of life. Sometimes they have traumatic injury, mental health disorder, and sometimes premature death. Why interest in epilepsy? This is one of the questions someone asked me during one of my PhD seminar. Why epilepsy? Growing up, I remember vividly in my primary school, there's this friend of mine, we were in a group, we used to play football together, talk together. Then we eat together, sometimes we go to their house and eat. But one day, one of his elder brother saw him having epilepsy. So everybody was scared. Since that day, we are scared of going to their house. We don't want to go to their house. Everybody think, let this thing not come and catch me. So then we thought it's a communicable disease. So because of that social stigma, I made big interest in it from that long time before I even entered school of pharmacy. So that is how my interest in epilepsy started. Difference epidemiology. It will interest for you to know that epilepsy is a major public health problem as declared by World Health Organization because it affects over 70 million people worldwide. So it's a serious public health problem. About 5 million people are diagnosed with epilepsy every year worldwide. So to bring the data come down, so with between 4 and 10 people in 1,000 people are said to be have epilepsy, active epilepsy, that is active epilepsy, not one that have not been diagnosed. And about, to make it more worrisome, about 80% of epileptic patients all over the world live in sub-Saharan Africa and Latin America. Why this area? Something is very peculiar to this region of the world. What are those things? Poverty, infectious disease, poor health conditions, poor health infrastructures. These are some of the things that make the thing. And the active epilepsy is more the incidence and the prevalence is higher in two age groups, the young and the elderly. There are also a reason for that. The prevalence is in Nigeria, according to statistics, is 8 in 1,000 people. So which is very high. It's at the higher side of the prevalence. And 2.5 times higher in rural areas than urban areas. And also higher rate is found in low income populations. And I think the reasons are not far-fetched. What were the wide treatment gap and poor treatment outcome contributed to high burden of epilepsy in African countries? That is just the reasons. Etiology from these factors. The major cause of epilepsy can be divided into structural in the form of traumatic head injury, or in terms of brain damage at parental or perinatal birth. It can be genetic due to congenital abnormality or genetic condition. It can be as a result of infections, as you have infection of the brain like meningitis, encephalitis, and others. It can be metabolic. It can be the initial part of its explanation for epilepsy. It was thought to just be imbalance between excitatory neurotransmission and inhibitory neurotransmission, especially when the balance is tilted toward excitatory. So that was just thought. So it was just based on neuronal imbalance explanation. However, many studies have shown that pathogenesis of epilepsy is associated with both neuronal and non-neuronal components, such as involvement of glial cell, astrocyte, microglia. And it is now understood that epilepsy is a cycle of inflammation, oxidative stress, immune modulation, which collectively lead to neuronal hyper-excitability that manifests in form of seizure and development of recurrent, spontaneous recurrent seizure. So the key pathological features in epilepsy are cellular plasticity, neurodegeneration, structural and cellular reorganization, blood-brain barrier disruption, astrogliosis, as well as microglia activation. So this is just a cycle that explains that. It started from a brain insult. A brain insult can be in form of trauma to the brain, infection, CNS infection. It can be abnormalities at birth. It can be any form of can be a result of stroke in elderly. Then that will trigger activation of glial cell, microglia, and astrocytes. And whenever, because microglia and astrocytes, they are the monocytes and macrophytes of the CNS, equivalent of monocyte in the central nervous system. So when there is any injury to the CNS or any insult to the brain, they will trigger the release of this thing. And of course, this thing will trigger inflammation, because we all know when macrophages and this infiltrate an area, there will be inflammatory release of inflammatory mediators. So to lead to neuroinflammation mitochondrial disruption, then oxidative stress because there will be release of reactive oxygen species. A lot of free radicals will release in the CNS, and this will further destabilize the brain more. Phases. The first called acute phase, which can be in minutes to days. It involves initial insult, as we explained. There is modification, molecular and cellular changes. Then to subacute phase. Subacute phase are between condition will manifest. So current treatments are in epilepsy. So for now, pharmacological treatments still remain the main approach in epilepsy. And it is said that 70% of people living with epilepsy, if they are properly, accurately diagnosed and they can receive, they can be seizure free. That is accurately. Please remember the emphasis. Accurately diagnosed and treated. But the problem is that majority of epilepsy patients we have, especially in Nigeria and other sub-Saharan Africa, is that they are not accurately diagnosed and treated. So that is why it's many problems. Then most of the currently available drugs act on ion channel based on initial hypothesis of the pathogenesis of epilepsy. So they were designed, they will know based on those ion channel, okay, we'll get a drug that can block ion channel, either in terms of blocking sodium ion channel blocker, calcium channel blocker, so that it will reduce excitatory neurotransmission, or the one that will enhance inhibitory neurotransmission. So either those drugs either work by between this either on ion channel or on neurotransmitter release. That's basically how they work. So it depends on which one. So the treatment is usually should be individualized. Then surgery is an option for patients that are not responding or that are responding poorly to drug treatment. Like in advanced countries, some people do what they do in part of the brain that is where the seizure is originating from. They remove it, then the patient will be seizure free. But the problem is this: how many patients in this part of the world can afford surgery? So that's a challenge, because epilepsy itself is a complex syndrome. Epilepsy is a very complex syndrome. It has multifactorial origins and also multifactorial manifestations. As I said, there is patient that has absent seizure, affect consciousness, may not result in convulsion, so may not know. So due to that heterogeneous nature and multifactorial origin of epilepsy, to treatment become a very, because if you develop a drug for treat one form of epilepsy, it may not be effective in this other form. So that is the problem. And again, another challenge, another limitation of the current anti-epileptic drugs is that they are associated with serious adverse effects. Some of them, they are not safe in pregnancy because of their teratogenesis potential. Some of them can cause hepatotoxicity. So some of them can cause other, even affect fertility problem. So, and also withdrawal symptoms. Some of them, unless there is a lot of time, the drug will no longer work. They become pharmacoresistant. And also, epilepsy itself is usually the disease process because of the pathogenesis of the disease, usually associated with the psychiatric disorder like depression and aspect of the disease, and also from the drug they take, and also affect their memory and other form of mental disorders. Then, until there is fully elucidation of the molecular mechanism of epilepsy, we may not be able to develop a drug that is 100% sure take care of epilepsy, because up to now, yes, there's better understanding of molecular mechanism. There's some aspects that are not fully elucidated. So we need to understand more. Another challenge is that there are a lot of research that have been done in animal clinical studies, but to translate it to human clinical trial, so there's a challenge here. So how do you develop an effective animal model that can be easily translated to clinical phases? So that is another challenge. One is no longer a dispute. because a lot of study has corroborated that, and a lot of evidence to show that both the clinical and clinical study have shown that. So till now, there is a continuous search for anti-epileptogenic compounds. So when you mean different pharmacological approaches has also been deployed, tested, aim at blocking enzyme, blocking seizure, and also preventing the development of epilepsy. For example, in, some of the currently anti-epileptic drugs have been studied in animal model to test whether they have an anti-epileptogenic effect by using a different way. Some of them like pregabalin, carbamazepine, toprimate, sodium, a lot of them have been investigated, but it's not all of them that show a promising result. Though some of them show few promising results. The same thing, some anti-inflammatory compounds in animal studies have shown promises anti-epileptogenic therapy. Since they say that inflammation is one of the processes that involve epigenesis, so researchers have also tried a lot of anti-inflammatory agents. We did one in my university, with my professor. We tried diclofenac to see whether it has potential. We carry out actually show a little bit potential that has other thing at the early study. Then there is a natural isoflavonoid. Those in pharmacology who know this, might know this compound, have been known to have anti-inflammatory neuroprotective potential. So it was tested to show their potential in preventing proteolysis, and it actually showed a positive result that you can do that. Then esylocarbazepine, which is what we call a metabolite of carbamazepine that is modified carbamazepine, that has a better activity than carbamazepine, has also shown some anti-epileptogenic effects in studies. Then, as part of my PhD work, sometimes 2019, I work on ginger as one of the nutraceuticals. So we tried different formulas. So I carried out some study in what's it called? The Institute of Pharmacology and Toxicology, Otto Bavarian University, Magdeburg in Germany, sometime in 2019. So what we try to do there was that we try to use ginger alone, because ginger has antioxidant, anti-inflammatory, immunomodulating property as part of it, has been established. So because of my interest in nutraceuticals, I've tried several nutraceuticals while I was doing my PhD. I made the choice I'm going to work on nutraceuticals. I tried all what's the name of this telephental occidentalis, this ogurin, and some other things. I tried, but I didn't know I now settled with ginger. So I took the extract to Germany. Then we tried to see ginger alone, then ginger in combination with sodium valproate. Sodium valproate is one of the bronze nature, because I believe that what exists in nature are free from God, and there are abundance of potential in nature. So natural products, there are source of alternatives that show that they have effects in neurodegenerative disease, in Alzheimer's disease, depression, other form of neurodegenerative disease, Parkinson. So, since epilepsy is a related neurodegenerative disease, so why not try them and see if they have so now there's a growing interest in natural products. Generally, there's a growing interest in natural products because we have followed orthodox medicine. We have found out that we are just being mentally colonized to believe that everything we have is bad, everything that came from West is good. So even Japan, India, some of them are herbs, but when they come here, they say it's all expensive because of the mentality we have. So we buy it especially thinking that you are better than your neighbor. But these things are abundant in our compound, in our environment. We have some of these cover. So why don't we develop it ourselves? Why don't we try it? So then those of us in academia and those of us in practice, so there is actually potential for you to try some of these natural products and see for various diseases, not just neurological disease, whether cardiovascular disease, metabolic disease, they have the potentials. Why nutraceuticals? What are nutraceuticals in the first place? Nutraceuticals are products that is derived from foods or their metabolites, secondary metabolites. They contain bioactive compounds that can offer health benefits that beyond basic nutrition. Beyond, if you take food beyond just giving you nutrients that will nourish the bodies, they also have medicinal benefits and some other things. So the word was first coined by Stephen L. Difflich, and it's forming from two combination of two words, nutrition and pharmaceutical. That is what they call it from. All of them, they are very rich, and medicinally they are very, they have values. So, how do nutraceuticals offer such health benefits? How do they do it carried out? They carry out various mechanisms. As antioxidants, they scavenge free radicals and others antioxidants. They help you to stay from. So they stabilize the mitochondria. They have anti-inflammatory process because inflammation has been involved in a lot of cardiovascular, neurological, and a lot of diseases. So you have something that can has anti-inflammatory effects. They have anti-exotoxic effects. They are able to maintain neuronal hemostasis. So then they have anti-apoptotic and space inhibitors. So they inhibit programmed cell death. So because when there is one of the program of epilepsy that is neurodegeneration, that is neuronal loss. So if they are able to protect loss of cells, of course, when you talk of cells in the brain, you talk of neurons. The modulation of the cell signaling pathway and this has various mechanisms which they act. So why will nutraceuticals be tried has potential as anti-epileptogenic agents? Why? The nutraceutical can offer potentially improved and safer integrated approach in pharmacotherapy epilepsy for the following reasons. One, they have multiple actions that can target various pathogenesis mechanisms that are implicated in epileptogenesis, as we explained earlier, whether in neuroinflammation, oxidative stress, mitochondrial dysfunction, etc. Secondly, they have favorable safety profile of natural products with fewer reported side effects. So, unlike the current medicine that they have notorious for having serious adverse effects, so nutraceuticals are safer. They have few reported effects. They also have potential for synergistic effects when combined with conventional disease, as I reported in one of my PhD studies. So they have potential for synergistic action when combined with other drugs. So unlike the current antibiotics drugs, because of their high tendency for interaction, so you are very careful before you can combine with another drug. And they also demonstrated protective effect against wide range of health conditions, including psychiatric disorder. I've explained before, some of these nutraceuticals have been used, a lot of studies, both preclinical and clinical studies have shown that they are effective in psychiatric disorder like depression, anxiety, cognitive impairment, like Alzheimer's. So, however, despite the therapeutic potential of nutraceutical, they face one challenge. That is a challenge of what? Bioavailability. So I believe this is where our colleague in pharmaceutics comes. So we can use a special delivery system to deliver the nutraceutical so that the patient can maximize the bioavailability of the nutraceuticals. So future research focus on epilepsy. What does future hold for epilepsy? So they need effective therapeutic agent that can uh, that can take care of those refractory epilepsy, the one that can provide prophylaxis, prevention, especially in patients that is exposed to the risk. For example, if a child is born and has head injury, or somebody has a head trauma as a result of road traffic accident, so that kind of candidate they are likely to have epilepsy in the future. So, is there any drug they can take so that they can prevent it? So that's a prophylaxis, or the one that can modify disease process. So such this thing is to remain a priority among surgery. Then also there are those that are also working to understand more about the molecular mechanism of epilepsy, and also there is a focus on the implementation of both diagnostic and prognostic biomarker in animal and clinical studies. So there's need to develop the biomarkers that can be used to a patient, just like you can do blood glucose test to know okay, this patient is diabetic. So there's people are working on those biomarkers that can be used to test okay, this patient is likely to have epilepsy or like that. So there are also research ongoing on that. Then there is priority on rigorous large-scale clinical trial on nutraceutical with anti-epileptogenic condition to validate their efficacy, safety, and optimal dosing in human. So a lot of nutraceutical have shown potential as anti-epileptogenic agent, as I highlighted in some of in my slides. So, but they need to go beyond preclinical. They need to go beyond animal study. This is to test on human. So that is focus of future research. Also, combination therapy is very important. I consider the fact that epilepsy is multifactorial in origin. So combining two or more drugs might be beneficial from their synergistic effect for them. Then, of course, the world is moving towards precision medicine and individualized treatment. So that's the focus. Summary and conclusion. Given the complexity, multifactorial etiology, progressive nature of pathogenesis, multi-target therapeutic strategies are increasingly recognized as superior to single drug intervention. And nutraceuticals, because they contain essential nutrient and non-essential bioactive compounds that exert head beneficial effects, can hope to exert through multiple mechanisms that include antioxidants, microbial function, enhancement of microbial function, anti-inflammatory effects, immunomodulatory, and neuroprotective activity. So, therefore, nutraceuticals offer a potentially beneficial and complementary approach to conventional therapy, mitigating adverse effects and also protecting against epileptogenesis. So, in conclusion, the multiple pharmacological target of nutraceutical position them as therapeutic alternative for disease modification in epilepsy, moving beyond traditional anti-seizure drug that only target symptoms, which is seizures. So, however, to maximize their therapeutic potential, the delivery of this drug can be optimized using a technology. So, thank you very much for your attention. Some of the references.
Thank you very much. It's now time for questions and answers, please. Can we start from the student? Any question from the student? Any question from the student? Aisha? Farida? Ask question, please, as usual. You don't have any? Level 5 student, it is a must to ask question from that Amana, faculty Igbo.
So good morning, my name is Abdulkat from Ramadan from 500 level. So from your presentation, saw you mentioned that 70% of people living with epilepsy could live without seizures if they are accurately diagnosed and treated. So, sir, what is that accurate diagnosis? Because based on the types of seizures, it can be very difficult sometimes to specify which kind of epilepsy one is suffering from. Thank you very much. The Aishas.
So from your presentation, you mentioned that 30% of patients present with pharmacoresistance. So my question
Open your mouth and talk, please.
is that how does pharmacoresistance cause epilepsy?
So you heard her? You heard what she said? Any other person? They're from the staff.
Okay, thank you very much for the. How can the epilepsy be accurately diagnosed? That's a very beautiful question. In a setting where you have um, good health infrastructures, where there is ideally you are supposed to have maybe if you are NHS, every people has you have the family doctor, you have the doctors. So you are supposed to have a immunologist that you see. For example, if there is any problem before even develop to epilepsy, they can be able to suspect that okay, this patient. But people that will have it may not be able to know until when the chronic form or is a generalized form of it. So epilepsy can be accurately diagnosed. For example, now if the facilities are available, for example, you can apart from other clinical this in feature that doctor can use to place. There is EEG that can be used machine that can use to monitor the machine. Doctor can ask you to do some basic tests that you'll be able to test some presence of enzyme or some things to be able to detect. Okay, they do EEG of course they monitor they check your brain to see if there is any to check the foci or the focus where there is seizure generating from. So these are some of the things. So and if you notice very well, anytime there is a problem where either as a result of accident, something happened, there is head injury. So one of the things they do is they use the check ECG because if there is head trauma, so that kind of person can likely have this thing. So after diagnosing it accurately, I diagnose okay, this person have seizure. It's supposed to go further to determine what type of seizure does he has. That is accurately. That's where accuracy comes in. If doctor will be able to, a neurologist, not just a general GP, it's not a GP job. You need to say a specialist in neurology in that field to be able to say, okay, this person has this form of epilepsy. Then you'll be able to accurately treatment, give you the drugs, the appropriate drug that can cure it. Then the question is, where those drugs has to buy it, will the patient be able to afford it? Because most of the broad spectrum anticonvulsant anti-epileptic drugs that are of newer ones that are more effective, most of them are not easy to buy. They are actually on the cost side. It's the only one that cheap is those carbamazepine, phenobarb, all those ones that are cheap. And those ones are not very effective in terms of that. But the ones that are very expensive are okay. So that is where it can actually be done accurately, where you have the facilities and the patient can afford the treatment. So it can be done. It's not a big problem. So once it's done like that, I know a man that has this thing. But over here, I think when I was in secondary school, when I knew the man had it. But the man has been living seizure free for long. He has been living seizure free for a very long time now. Because he takes his drugs, do everything. He's not having seizure. Because at a point, when if you are taking your drug very well, there's what you call aura. When person is about to have the seizure, there is a sign that you show. person will know that it's about to have seizure. If person maybe is operating a machine or is driving, he can just quickly park and just lie so that whatever he has, he will not have a traumatic injury, but it will not affect him. But most people, once they take their drug very well and take the right drug very well, over time they'll be able to. That brings us to the next question. How does pharmacoresistance develop? It has found that when a patient take a particular kind of drug, for example, take carbamazepine or phenobal for a long period of time, over time, there is loss of efficacy. So the drug no longer, if the drug used to reduce the frequency of seizure, maybe he used to have seizure 3 times in a year before, it will no longer be able to do that. The seizure will be more frequency. So it shows that the drug is no longer working. So if the patient is visiting his neurologist very well, so what they usually do is to change to a better drug for the patient. So that is how the pharmacoresistance develop. I think I'll answer the question.
Sir, in one of your slides, you mentioned that the mechanism of epilepsy is not fully understood. So, uh, sir, how do you assess students that reply or write in when you ask a mechanism of action of a drug and he writes you that it's not fully understood? This is one. The second one, sir, here traditionally, yeah, traditionally, there is this belief that epilepsy is a spiritual attack. This is a common, belief in this part. I think in African content, we have this belief. And that you see some instances where they even go to Babalao, or they go to one Malang, to one pastor to recite verses from Quran, from Bible. And for some patients, you see maybe the epilepsy start after starting the recitation or incantation by the Babalawo. So, sir, during your research, have you, go into this area? I know that they used to give concoctions. Maybe this natural, and sometimes you see improvement. So, is there any chance of collaborating with these people when it comes to research in nutraceutical, more especially with emphasis on epilepsy? And do you think something positive can come out of that? These are my questions. Thank you very much.
Mommy.
Thank you, Dr. Itopa, for your wonderful presentation. And believe you me, even me myself, it has been a source of concern to me, epilepsy. I have a sister-in-law who is epileptic, and because of that, till today, she's not married. She's over 50 years, almost 60. You started with a story, your presentation, that you had a friend who was epileptic, and from there, when he had an attack, people start moving away from him. Now, after your presentation, we expect you to tell us if now you understand more, it's not communicable. How now can you, actually acquire such, case? That's one. Then secondly, when you mention resistance, I become like my ears opened. Even in epilepsy, drugs are becoming, what is resistance now? I don't understand. In microbiology, we know organisms will get resistant to antibiotics. Now, I don't know, probably I don't understand that mechanism of resistance very well. It's really interesting me. I might meet you personally. You might not here, I'm interested in it, honestly. That there's also resistant, anti-seizures, anti-epileptic. That's interesting, wonderful. So, please, I will meet you. Thank you, Dr. Itopa.
I want to acknowledge the presence of Director of Pharmaceutical Sciences, Federal Teaching Hospital, and I will also plead with him to ask a question, please.
Good morning, all. Yes, it was a very good presentation, and it's timely. What I just wanted to as it's just a comment, not a question. But actually, since we are dealing with student and potential 500 level that are going to the system and start doing some of the activities that, what do you call it, make them their primary function, we feel that most of the people that are around now, the nutraceutical is like just something that is being diverse and everybody is using it, whether he knows or he don't know. But most of the time is some people, they were asking somebody, you have this drug you wanted to give, but you didn't talk about the interaction that may likely arise from using the two drugs together. Therefore, it is not only for you to ask when you are giving paracetamol and somebody is taking another drug, orthodox drug. Even if somebody is taking a nutraceutical, you have to ask him so that you know that even nutraceutical can also ultimately affect or create some interaction and it may render your drug useless. I heard Madam was talking about resistance. So resistance exists in different forms, either intrinsic or extrinsic. But that one is another issue altogether. But it's very, very important to understand now. A lot of people are taking nutraceutical and they were not telling because they didn't take them as conventional drugs or orthodox drugs. So therefore, if they were taking these ones and also they are taking the orthodox, you find that people are just coming back to the hospital without any effect. While the diagnosis is okay, the drugs are okay, but at the end of the day, they were not seeing the results that was supposed to see. So please and please, if you ask somebody what kind of drugs are you taking, even if it asks him the nutraceutical or even traditional medicine, so that you'll be able to give him an appropriate information. Thank you very much.
Thank you very much for the comment. Do you have another question, please?
Thank you very much, Seminar Coordinator. On behalf of my head of department, in the person of Dr. Hadiza Ibrahim, thank you for a wonderful presentation, sir. This presentation is supposed to be in Pharmacognosy department. Yes, because we have nutraceuticals in 500 level, DCG 502. And additionally, as you mentioned earlier, we are utilizing the biodiversity that we have. We focus more on the imported drugs. For example, now I met one American that he told me that they are in Nigeria. They are searching for possible anti-cancer drug in Nigeria. While you and I, we are sleeping, waiting for them to develop the drug so that we buy. So I think I would like to call on the researchers, more especially in drug discovery, to focus more on the plants so that we can utilize the biodiversity that we have. Thank you very much.
Thank you very much, Amana.
Thank you for this wonderful presentation, sir. When you were mentioning the adverse effects of these anti-epileptic drugs, you made mention of fertility issues. So I was concerned about that. Is it that it's attributed to a particular class of these anti-epileptics? And what mechanism? Is it dose dependent, chronic use, age specific, or in special population? Because you see that there are children that were taking these drugs since when they are 3, 4 years, 5 years, and up to the time they grow up. So that is why I'm most concerned about this fertility. Is it with chronic use or dose dependent or in special population? Thank you very much.
Do we have another question, please? Okay, let me take one from the online. So someone is asking, what are the current advances or trend in the roles of nutraceuticals in the epileptogenesis?
Thank you so much for your presentation. My question is related to this nutraceuticals. You've only mentioned ginger. That's what stood out for me. I want to know, because I've come across several times when I was trying to do a project with my student, especially on epilepsy. I thought of, because I've seen several papers online concerning combination with THC. I don't know if you've seen any, and how strong are those maybe potentials for combining anti-epileptic drugs with THC. I know we all know what THC is, right? Cannabis, yeah. So they're very. I saw the several research on that. So I don't know. Apart from ginger and THC that I think I saw on my own, what are other nutraceuticals that you have seen in your literature review?
Do we have any question?
Well, thank you very much for the questions. I will attempt to answer some of the questions. The question from Acting Dean. Yeah. When you say the molecular mechanisms of epigenesis is not fully developed, it doesn't mean that nothing has been. Because, of course, without understanding the pathophysiology, it's because of the molecular medicine that I understood that made us to be able to expand the pathophysiology of epilepsy to now involve inflammation, oxidative stress, and mitochondrial dysfunction and the rest. It has got us true, but they still need to understand more. So you want 100%. In science, even when you achieve results, you can still go better. So that's why when drugs are developed today, you try to develop a better one tomorrow to correct the limitation of the current one. So there's some gray areas which researchers or scientists are not satisfied with. So that's why they are seeking for deeper understanding of molecular basis of this. Then you also talk about the role of spirituality. I'm not a spiritualist, I'm a scientist. I'll speak like a scientist, but it is not in my habit to come and condemn spiritualism. No, if I do that, I'll be wrong because I also believe in spiritualism. Of course, we're all Nigerians. African general we believe in spiritualism. So people have carried their cases, medical cases to meet spiritual, whether man, pastors, or this. Fortunately, some of them get solution. Unfortunately, some of them don't get solution. So let us go into it. But all I know is that epilepsy is not a spiritual attack. It's a neurological disorder. Epilepsy is not a spiritual attack. It's a neurological disorder. And a lot of studies have been done. Ruled out the importance of herbal medicine, traditional herbal medicine. There are those herbalists, traditionalists, that know some of these herbs. In all, not just epilepsy, in all other diseases, whether it's hypertension, cancer, so there are herbalists that know these drugs. So said, because herbs is the oldest nutraceuticals, and it contains some of these phytoconstituents are there that have medicinal values. So it is our duty to explore them, to be able to get them. So those in research, whether in pharmacology or pharmacology, anywhere you are, is to collaborate with those traditional leaders. Let them open up so that you know. Yes, as a matter of fact, the plant I work on from MSc I was one man I helped in Abuja to get it. I think the herbalist is in one of these village in Escoch of Abuja to help me get it. I work on. So you can actually collaborate because there are great potentials. So the only problem in traditional medicine is lack of regulation and control how to, because you need dosage, proper dosage for time of disease and so on. If not, you cannot condemn them. They are doing an amazing job. They have the potential out there. So scientists don't condemn them. Don't think because you have the vertebrate, they will now condemn them and think that they are not doing anything. No, please collaborate with them. They have some of them have this folkloric knowledge that given to them from generation to generation, so they can help you a lot of with a lot of information. Then yes, I talk about stigmatization attached to it. Unfortunately, whenever I remember that incident, that my friend's brother's incident, I just laugh myself. So we've been trying this all this while because then we need to because ignorance is a very big thing. If something you are ignorant of, you make it to act. But then we didn't know. We just assume that there is this stuff that if you are close to him, you get it. Because what made it worse was that in that family, there are up to 2 people that have it. So you understand? So it makes us to be scared that, okay, this is actually communicable. But actually, epilepsy is not communicable. So on the stigmatization attached to epilepsy, it is our responsibility as enlightened citizens, whether as pharmacists, as a pharmacy students, everybody to know that this thing is not, maybe as part of your past weeks or health outreach you do, educate people, let people know that these things are not communicable. Let not discriminate those people that have it. And a breast patient can get married. It doesn't, once he's taking the drug, nothing have it to control. But because of stigma attached to it, so we look down on those people. So it's something we have to do something as people. And then in terms of when resistance, yes, yeah, you know from your backgrounds as a microbiologist, so the only thing is only microorganisms that can develop resistance. No, there are some of resistance that develop in terms of when there is loss of in pharmacology, there is what we call receptor drug and receptor binding. When that, because for a drug to bind to receptors, there must have affinity. So when the affinity is gradually loosened as a result of molecular changes or something happen, either mutation or something happen, so it will not, the drug will not fit properly into that receptor again. So it will not start losing it. It's one of the mechanisms too. Then it can also in form of certain mutation can happen where certain proteins is generated that decrease the concentration of the drug at the receptor site. So this can also make the drug, even though the patient is taking it, is not getting the result it used to get until change to another drug. So they are very, it's a complex explanation. There are many other things where it can happen. Then interaction with Pharmaceutical, as the director said, please, is a very, let me tell you one interesting story that happened when I was carrying out my PhD work in Germany. So when I was administering my ginger in the study I carried out in Nigeria before I traveled to Germany, nothing, my animal was doing well, nothing happened. But when I was carrying out the study took me like 3 months. In one of the times, I discovered that my mice are dying every day. Sometimes I came to the lab, I packed like more than 6 or 5 animals that died. I felt very sad. I didn't know about it. I approached my professor there. I said, sir, these animals, they are dying. I don't know what happened. He said, but ginger has been used, all toxin, this. So he now said, okay, what we'll do, let's do some other study. Besides my study, we'll now do some other study. So I don't know if they will now discover that ginger was causing hypothermia on the animals. And during the time of my study, that was during winter time. We just found winter time. So the cold was too much for so even the animal will die. The animal will not have seizure, but they will die. So I'm trying to corroborate what I need to say. So you cannot rule out completely that even though you are being told that this is natural, what I would advise people is that once as a pharmacist, once you are recommending nutraceutical supplements, but always advise the patient to check the content of the what's it called, of the supplements, because some of these supplements are multi-components. They have other components, and either one of them can be interacting with other non. So it's very important to not to rule out interaction. Then we talk about okay, Dr. Samuel, thank you very much for this. I think actually, yes, pharmacology and pharmacology, there is this argument we used to argue in my university. We say that pharmacology are given to pharmacology. We say that pharmacology are given to pharmacology. So I'll leave that for another day. But it is that medical practice started from plants, whether we like it or not. So even though we try to run away from plants, but we are going back to the plant now. So I'm very happy about that. So there is that always room for collaboration between technology and what they call pharmacology. So sodium valproate can affect the fertility of both men and women. So maybe at a particular point in time when the patient is taking it, if the patient wants to aspire to raise a child or to look for a child, it can stop it for that period of time. Because the effect is reversible, it's not a permanent effect. So as long as the patient withdraws from the drug, it will stop. So there is not all of them, there are some of them that, and it always clearly stated in their profile. So then on the current trends on the role of pharmaceuticals. So the current trends is that nutraceuticals are recommended as adjunctive therapy, not just only in epilepsy but in other neurodegenerative disorder, whether psychiatric disorder or no. So they are recommended as adjunctive. But we are saying that from the profile of some of the nutraceuticals, they are not just as adjunctive, they play a role more than adjunctive therapy. But the current trends are they being used as adjunctive therapy to support the main conventional drug used in epilepsy. Then on the other nutraceutical, just like from Ram said, THF, that is THC cannabinoids. A lot of study find out. I came across it when I was doing my PhD work. I saw it a lot of reports. It has potential in epilepsy, not just in epilepsy, some other neuropsychiatric disorder. There are a lot of this, but the problem is because of the restriction on accessibility of getting. You cannot get cannabinoid. It's very difficult for you. If you want to cultivate it now, I'm very sure they cannot allow you to cultivate it in the pharmacy, in the garden, because if not, NDLA will visit you. So these are the challenges, is the accessibility of getting it. But actually a lot of studies have shown that they have high activity against in epilepsy and other forms of psychiatric disorder. So as I said, and I just mentioned some here because of time constraint, but there are a lot of other nutraceuticals which, if you Google, which have been found very useful, not just in neurological disorder, in cardiovascular disease, metabolic disease, and others, like alpha lipoic acid, coumarin that is derived from turmeric. So there are so many of them that have even what's called the most this is really from tomatoes. What do you call it? Lycopene. Lycopene has, in fact, initially I wanted to work on lycopene when I was doing this, like, but when I see that people have done similar work, that's why I do like lycopene has found to be very busy. So there are a lot of them that a lot of nutraceuticals that are very useful. And not only just listen, a lot of studies have confirmed their pharmacological activities. So thank you very much.
Thank you very much, sir. Is it a comment? While the sir will be making the comment, I'm directed to ask the members of the staff and high table to move up to the high table for a brief launching, please. Just few minutes.
My comment is regarding the THC. So I think it is high time this country legalize cannabis sativa because some other states in US and Latin America they legalize this cannabis sativa. It's a drug. Put the abuse aside. It's a drug.
Actually, he has a point. The problem of Nigeria is that you remember when codeine that we are managing for dry cough and that thing, but it seems from how some bad guys turn into addictive drugs. Then they have to make it a control drug. So that is the problem. So can we, until we could make our drug distribution channel to properly follow the guideline, national guideline for drug distribution, where you can control drugs, that is where you can legalize some kind of thing. But for now, as our drug distribution is in a chaotic situation, if you do that, at least those cannabis will find hand to terrorists and bandits and all these people that are criminal, all the hardened criminals. So that is a fair. So we have to put our house in order first before you can legalize something like THC. So it's very it's a serious legal and security issue. There are some legal and security issue about it. So until we settle those one. So, but actually in US, like some states in US, like in California and some other states in US, it's legalized. It's legalized. People are allowed to use it. No, no states are not legal because it's still a subject of litigation. You cannot legalize it when Nigerian law supersedes state law. So there is still a problem, but there is a move for the state to do it. But it's going to cause a problem. So, but actually, there is a potential in cannabis, a lot of medical potential. But as I said, we have to put our house in order and also solve the legal and security challenges that are involved in it.
Thank you very much. Before I give the mic to the MC for the launching, the acting dean is representing the faculty and also is representing A and I Nagarta Medical Sciences, and also the chief launcher is Alhaji Jabir Adamu, which is heavily represented by my friend Pharmacist Haruna. And also, we have many representatives which will be read by the MC. Carry on.
Good day once again, distinguished guests and my fellow students. Like he said, we will request the high table to please go back to their seats so that we'll proceed with the launching. And then we have other invited guests and their representatives that will also acknowledge. We have the Royal Father of the Day, in person of Dr. Ibrahim Sabo, and then we have our chairman of the event, Dr. Sebastian Zuberu, who is represented by Pharmacist Joseph Samuel, and then we have Pharmacist Ochuli Adamu Jonathan, and we have our chief launcher, Dr. Jabir Hamza, represented by Haruna Adamu. We have the director of Pharmaceutical Services, Federal Teaching Hospital, in person of Dr. Salah Adamu. And we have our chairman, okay, like I said earlier, we have our chairman represented by Mrs. Joseph Samuel. And then we have the PTN chairman from Roda, represented by Mr. Aram Hezron. And we have the PSN chairman of Gobe, from Usman Mohammed, represented by Dr Itopa Musa. So they will make their way to the high table and then we will proceed with the launch. So at this point in time, we will move to the main highlight of the day, the official launch of the PANS magazine. To lead us in this, I will invite Our chief launcher, Dr. Jabir Hamza, represented by Pharmacist Haruna Adamu, to kickstart the event.
And the greatest sponsor, I want to dispense. I want to formulate. Thank you. I am not the chief launcher, as you know. I'm here to represent Alhaji Jabir Adamu. On behalf of Jabir Adamu and his family, he is launching a copy of the magazine with 100,000 naira. So I also encourage the members of the high table to support the activities of the fans by donating generously towards the activities of the fans. Thank you.
Thank you very much.
And next on our list, we have the chairman, Dr. Sebastian Zuberi, represented by Pharmacist Joseph Sample.
With the permission of the high table, please, can I gyrate more? Of the greatest Nigerian students, Pastor Ginger, Pastor Swagger. What's happening to this concert? All right, please permit me to stand on the existing protocol. My name is Pharmacist Samuel Joseph. I'm representing my boss and mentor pharmacist, Dr. Sebastian Zuberu. I wish you guys a very successful week ahead. And well, since I'm here, personally I'll be launching a copy of the magazine with the sum of 10,000 naira. And on behalf of pharmacist Dr. Sebastian Zuberu, I'll be launching this magazine with an undisclosed amount. Thank you very much.
And next on our list, we'll be inviting the acting dean to also launch the magazine.
Okay. On behalf of the faculty, I'm launching copies of this magazine on amount to be decided by the faculty business committee. For A&I Nagarta, I'm launching 5 copies on the undisclosed amount.
And next on our list, we will be inviting the representative of the PSN chairman in person of Pharmacist Dr Itopa Musa to launch the magazine.
Greatest fan site. Greatest fan site. I want to isolate. I want to dispense. I want to extract. On behalf of Pharmaceutical Society of Nigeria, we will be sending our contribution once I finish talking with the chairman. He is currently on an official engagement. Please bear with us, but I will forward it to the account. Thank you.
And the next person we'll be inviting for the launch is our invited guest, Pharmacist Nuruddin Abdul Salam Rada, Facility Director, Chief Operator of Hayat Pharmacy and Vet Dot Limited.
On behalf of myself and Hayat Pharmacy and 2029, we'll be launching a copy of the magazine for the sum of 100,000 naira. And I would like to seek the permission of the acting dean and Dr. Musa on his wonderful presentation. There is a disconnect between what goes on in the academia and the industry. The first comment I made was that the industry actually serves as the bridging gap between research that are being conducted in the academia and commercial availability of the outcome of that research. So in the industry, when we talk about drug formulation and development, it's a multi-specialty effort from those who conduct how to engage or transform a laboratory scale results or outcome into a commercial viable manufacturing process. As long as the academic works, research are not translated into commercially beneficial outcome, the research is not complete. So my advice to the acting dean and various heads of department is there should be a relationship, a way to collaborate with those in the industries, to come and take a look at what those in the research are doing, and also support some of these researchers. And if possible, patent some of the research outcome and make it a commercially viable venture. Thank you.
And next on our list, we'll be inviting the representative of the PCN chairman from Roda, who is represented by Mr. Aaron Hezron.
Great Nigerian student, permit me to stand on the existing protocol. My names are Aram Hezron Kala, the admin officer of Pharmacy Council of Nigeria, Gombe State Office. I'm here to represent the state officer from Rhoda Aminu Stephen. Here with me is 1 minute speech for our great Nigerian student. Please let me read. Wherever I say I refer to from Rhoda Aminu Stephen. The president of PANS, the dean of the Faculty of Pharmaceutical Sciences, distinguished lecturers, invited guest fellow pharmacists, in training, ladies and gentlemen, good morning. It is indeed a great honor and privilege to stand before you today as a special guest of honor. At this year's PANS Week opening ceremony, I sincerely appreciate the leadership of PANS for the kind invitation extended to me. And I congratulate you all for organizing this week of celebration, reflection, and learning. PANS Week is not just another week, another event in the academic calendar. It is a time to celebrate the strength, unity, and excellence that define pharmacy students across Nigeria. It is a time to showcase your intellectual capacity, your creativity, and your commitment to service and professionalism. Pharmacy, as well as we all know, remains one of the oldest and noblest professions. It is one that requires integrity, precision, and compassion. A pharmacist is not just a dispenser of drugs, but a guardian of public health, a counselor, a researcher, and a bridge between science and humanity. As young and aspiring pharmacists, I urge you to make the most of your time here. Build not only your academic competence, but also your leadership, communication, and ethical foundations. The world you are stepping into demands innovation, teamwork, and continuous learning. The future of healthcare in Nigeria depends on how well you prepare today. Let this week activities, the lectures, and social events remind you that the pharmacy is not only about textbooks and laboratories. It is about people, purpose, and progress. Use this opportunity to strengthen friendship, learn from mentors, and renew your passion for your profession. Conclusion. As we declare this Palms Week open, I encourage every student to participate actively of all discipline and project. This image of pharmacy with pride. May this week inspire new ideas, foster unity, and move the association to a greater height. Once again, congratulations to the PANS executive and members for putting together this wonderful program. I wish you all success and memorable PANS week of celebration. Thank you. And to support this launching,
acknowledge the payment received from the CEO Kairat Pharmacy, from the Director of the Oil and Rice Milling, and also from Dr. Hadiza, from Dr. Temilola, from Farm Tabita, and from Farm Joseph. Thank you very much.
And the next person we'll be calling on for the launching is our royal father of the day in person of Dr. Ibrahim Sabu.
Permit me to speak in Hausa. Mazanya ɗan amanan ƙasar Findiya. I have sent the sum of 50,000 to the treasurer. And as Dr. Ibrahim Sabo, I will add the sum of 50,000 naira.
A big round of applause, please. Thank you very much.
Thank you very much, sir. And the next person we'll be calling for the launching is our HOD of the Department of Pharmacology and Therapeutics in person of Dr. M.I. Yakubu.
Greatest fan side. On behalf of myself and the departments, I will launch a coffee for undisclosed fee.
Thank you very much, sir. And the next person we'll be inviting for the launching is our lecturer from the Faculty of Pharmaceutical Chemistry, Professor Usman M. Gombe.
Good afternoon, all students, Pharmaceutical Science students of the State University. I'm pleased to be with you, and I've been here for quite a long time. This is not the first time I'm attending launching of PANS magazines, and I wish to continue. With that effect, I'm going to launch also on undisclosed amount that I will communicate to you later. Thank you very much.
Before the closing remark, on behalf of me, I and myself, AG Enterprises, we are asking the sum of 10,000 naira cash. And I would like to call on Prof. Gombe for a closing remark. Then past activities will continue.
Yes, once again, good afternoon. I'm here to give a closing remark. Particularly, I'm so pleased to have a wonderful presentation from Head of Department of Pharmacology. He has done it very well. All of us have learned a lot as he has done justice to the topic. I intended to ask a question, but maybe I will chip in when we meet later. He will tell me. He has worked on crude drugs in Germany. In most of studies on crude drugs, usually a questions come in. Which type of phytochemical constituent is responsible for your activity? This is a question that mostly run around pharmacology, pharmacognosy, and well, natural product chemistry in my department. And to that effect, I want to particularly find time so that you can, if you can explain more, or if there is a such studies that you extended to identify the natural constituent that is responsible for the activity, being that you work on the crude extract. You have said a lot, and we appreciate it. A lot of questions has come in, and the reason for that is many people has learned from what you have presented. The acting dean of the faculty has done well and is doing well because he's always active, attending one program to the other. And even though he's absent, himself and industrial pharmacist Nuruddin Abdusalam, who is here on transit to Adamawa State, but he decided to stay here. We are extending appreciations for his presence and concern to the Faculty of Pharmacy of the state students. The head of departments are all present, and they show their commitments. We expect that parental guide will not only stay here, but it will continue not only in the halls or classroom, but rather anywhere when they meet pharmacy students, they will give them that guide, morality, and commitments. We appreciate their commitments, their presence, and not only the head of departments, all the academic staff in the faculty that are here and those that are not here. Even our faculty administrator or the faculty officer who is actively here since 9 a.m. to make sure that this role he plays is deep inside his mind to see that we make it a very successful one. We thank you for your presence and we appreciate. Please a round of applause to the faculty administration officer. The organizing seminar coordinator, who is also my brother, he was telling me about this program, which I intended to travel today, but I decided to stay so that I can witness it. I thank you for making it very possible and very lively. The past leadership is your time to show that you have done something as a legacy which can be comparable to other past leadership at the previous time or leadership, which we expect every leadership to come out to show one or two things new from the other previous ones. We thank you all. The past, please remain committed to your professional studies, and we expect soon all of you should be or replace our position at the high table. Once you graduate, your struggle started. So we thank you all, particularly not only the final year students, but all the students that find time to come and attend the program. So on behalf of the acting dean and the faculty at large, we thank everybody for coming, and we pray that at the end of the program, we wish everybody a safe journey back to his either office, hostels, or even outside campus. Thank you very much.
Thank you very much. A round of applause, please. Before we take our leave, we'll take two more presenters. My apologies, please.
Two more presenters.
Great pan sites. Look at this podium, top person, make us stand like this, man, sit down. Congratulations to all pan sites for this wonderful outing. I've already appreciated Doctor for his wonderful presentation. I gained a lot from the presentation. I'm standing here as your patroness. I believe in the patroness of pan. I'm standing here as your patroness to encourage you, to tell you well done for all the good works you are doing, and to remind you that you are here for studies. Please don't forget. Don't allow other things to overwhelm you. I'm also standing here to tell you that from yesterday, we are creating awareness. World AMR Week. World AMR Week. That's World Antimicrobial Resistance Awareness Week. We all have done microbiology one level or the other, except the 100 level. It's your duty to tell people the risk of taking antibiotics wrongly. It's your duty as pharmacy students to go and create awareness. Don't use antibiotics wrongly. It's a risk not for the person taking it alone, even for you and I that are not taking it. Because somehow, it will come back to us. So please go out and tell them that let's secure our present. He said, if we act now to protect our present, list of antibiotics through their proper use, we can be sure to secure our future. Access to effective antibiotics and prevent dumb prophecy of an impending post-antibiotic era, where no effective antimicrobials will be available to treat infections caused by resistant microbes. It is dangerous. Already we are there. There's a menace. You go to hospitals, people are dying because of resistant strain of microorganisms. In fact, the mortality of resistant strain is higher than malaria, it's higher than typhoid, it's higher than TB. Because it's silent. You will not know, because each patient will die of this strain. You will not know of this problem. You will not know. Please use your antibiotics well. Complete it. Don't decide to just for your own not use antibiotics. Don't use your antibiotics halfway and leave it. It's dangerous. Don't for your own prescribe antibiotics for yourself. No, it's not allowed. It's dangerous. Please carry this news and let everybody know, because it's affecting you and I. Thank you very much.
Thank you very much. From the existing literature, direct in which pathogenic